Hi, I'm Dr. Brian Kim, medical retina specialist at Harvard Eye Associates. Today I'd like to talk about diabetic retinopathy. Why is it so important that we have to have eye evaluations when we're diabetic? Let's start with diabetes. Most people, if not everybody, knows that diabetes is a problem of sugars, but it's really a problem of blood vessels. And it sometimes helps to think that sugars are crystals, and crystals, when they're flowing through your blood vessels, are sharp and they can pop and puncture the tiniest capillaries in our body. Now, the only place that we can actually see these tiny blood vessels is in the back of our eyes, inside our eyes. And we like to use this as a litmus test, so to speak. So whatever's happening in the retina and inside the eye is actually happening everywhere else in the body. Your diabetic specialist, your endocrinologist, or your primary care doctor needs to know the information that we see in your retina to know how to better treat the rest of your body. So diabetes in the eyes can be daunting, and a lot of people want to know why we need to see at least annual eye exams for diabetes. The problem is that when these tiny little crystals fly through the blood vessels, people still see very well, and they see very well for a long time until one day, boom, suddenly the vision starts to change all of a sudden, and it can be very scary and very difficult to reverse any damages that have occurred. But if we're able to catch that at a much earlier stage, we can oftentimes preserve and prevent any sort of permanent vision loss. Now, it helps to think of blood vessels kind of like garden hoses. So you have your garden hose and you're watering your flowers. And if you have one or two tiny little holes in your hose, water starts to spurt sideways. And in the earliest stages of diabetic retinopathy, we might have one or two tiny little bleeds that are visible inside of our retina. But that's okay, because enough blood is actually going forward and feeding the retina. And in a sense, the flower is still doing fine. But if you start to accumulate too many holes in this hose, well, then more water is going sideways, not enough water is going forwards, and the flower starts to suffer. And this is when we start to have issues in the retina. We start to lose patches of peripheral vision usually, but it's so small and so mild in the early stages that we don't notice it. Our brain is able to fill in the gaps. It's not until the very most severe stages, or the final stages of diabetic retinopathy, that we actually start to have vision symptoms. So by then, it's oftentimes very advanced, and it will require a lot of work to try and reverse or stabilize the eye. So very important. If you have diabetes, please see your eye doctor, retina specialist, somebody who will take do a dilated eye exam on you, and make sure that we evaluate how severe, if any, your retinopathy is. It's very important that your eye doctor work very closely with your diabetes doctor, at least on an annual basis, if not more frequently than that.